Excuse me, ma'am. Can I help you?
Do you guys need any help?
We were kinda busy with an rollover accident with entrapment and ejection here.
Well, I am a nurse.
Oh, well maybe. What kind of nurse are you?
Well, I work in the hospital on the general medical floor.
Well, I don't have much help here on scene yet, so I guess you can help out until my engine company gets here. I need you to hold C-spine for me.
C-spine? What is that?
I'm sorry, I misunderstood you. I thought you said you were a nurse.
I am a nurse, but I don't work in neuro. I just give medications and baths.
You don't have to work in neuro to know what C-spine is, you retard. Hold his neck in a straight line and don't move it.
Okay, I think I can do that.
Here, put this collar on the patient.
How do you put this on?
Well, from the looks of it, you wrap it around their neck and put the two pieces of Velcro together.
Okay, it's on. What else do you want me to do?
Well, for starters, you can turn it around and put it on correctly.
You didn't tell me which way to put it on.
I didn't think I'd have to hold your hand through putting on this simple collar. I would have thought the indentation for the chin might have given it away which way it should go on.
Okay, is this the right way?
Yeah, you finally got it right. I guess if you want something done right, you should do it yourself and not ask a nurse to do it.
What was that?
Oh, nothing. I was just talking to myself.
Oh, okay, I just thought I heard something.
This guy is crashing fast. I need you to insert an oral airway while I prepare for intubation. Make sure you check for a gag reflex first. I don't need this guy puking all over me while I'm trying to intubate him.
Okay, I'll check.
What in God's name are you doing?
I'm checking for a gag reflex like you asked.
By sticking your fingers down his throat.
How else am I supposed to do it?
Well, you could try an unconventional method by checking his eyelids to see if they twitch when you touch them.
Oh, okay, I never really thought of that.
That doesn't surprise me. I forgot that you are incapable of thinking on your own.
What was that?
Oh, nothing. Just talking to myself again.
Okay, he doesn't have a gag reflex. Do you want me to call the on-call doctor to get orders to intubate?
No, I don't need you to call the doctor. We are able to think for ourselves out here in the field and can intubate if we need to.
You can think would be so much easier if we didn't have to call doctors all the time for orders.
Yeah, it would probably be easier to if they actually trained you to do other things besides give medications and baths.
Well, we also perform lots of charting, and usually sit on our asses all day eating free food that the drug reps bring in all the time.
That's not really surprising.
What do you mean? We work very hard up on the general medical floor.
I'm sure you do. Working hard in cafe world and Facebook, and gossiping with all your other nursing friends about how hard you are overworked working 3 shifts a week.
We work 12-hour shifts. It gets exhausting.
Oh, my apologies. Who am I to say anything when we work 24 hours at a time, and rarely get to sleep through the night because we're out saving lives all night? What was I thinking? You know what RN stands for?
Yes, it stands for registered nurse.
No, it actually stands for really nothing because you can think for yourselves and need orders to even give a patient a pillow.
That's not true. We can't give them a pillow without talking with their doctor. We just cannot give them any ice or water without consulting their doctor.
See, that's exactly what I mean. That's why I became a paramedic, so that I could think for myself and make decisions that are best for my patients.
Well, at the end of the day, I go home knowing that I've made a difference in someone's life.
Really? It sounds to me like the only difference you make is annoying the hell out of the doctors because you have to call them non-stop just to feed a patient. You take just as many orders as a McDonald's drive-through employee.
That's not true.
Do you carry your nursing license with you at all times?
Yes, I always keep it in my purse with me in case I need it for anything.
May I suggest that you carry a ketchup packet with a license at all times as well?
What would I possibly need a ketchup packet with my license for?
That way when you kill a patient because you can think for yourself and lose your license, it makes it much easier to eat.
Oh, I get it. That actually makes a lot of sense. Thanks for the suggestion.
No problem. That's my job to help people. Oh, and by the way, next time you see an accident, don't stop. Just keep on driving and let the people that can think for themselves handle the patients. They stand a better chance of surviving that way.